So you're in for a treat today. You get to bear witness to some great testimonials. My name is Rebecca Melendez, Program Director with the East Los Angeles Women's Center. That's our, now to all of you, I was going to say that's our staff clapping. Thank you, everyone. I get to introduce to you our panel of survivors. Joanna Griffin, she, her. She's with the Jenesse Foundation, representing the Jenesse Foundation. Yes. Joanna, did you wave to your people? There you go. Joanna is a survivor, motivational speaker, board member, and future DV advocate counselor. Juan Perez. He, him, is representing the YWCA of San Gabriel Valley. Gio's not biased. He is a domestic violence warrior. And Cecilia Lorena Picasso, she, her, ella, is representing the East Los Angeles Women's Center. And she likes to be referred to as a domestic violence survivor. Last, with Futures Without Violence, is the incredible, incomparable Virginia Duplessis. I'm the one who said incredible, incomparable. She doesn't call herself that. And I'm going to be sitting in on this session today as the English interpreter. So a lot of you know that we have Spanish interpreters on hand. And for those of you that are Spanish challenged, I will be interpreting for you. So, are you ready to get started? Okay, here we go.
Great. Thanks, everyone. I know it's the end of a long day, but I like to say that this is probably the most important and impactful part of our day. As we opened up, Lon and Dr. Raghavan really talked a little bit about their experience supporting survivors and how important it is to really center the experiences of survivors when we're doing this work. And now we get to hear directly from a panel. So obviously, all the folks, there's so much wisdom and strength. We have a warrior here. I love that. First time I've heard that. We could be here for days, right? Talking about the experience of surviving, healing, and thriving. And since this event is really focused on the healthcare, what healthcare can do around prevention and response, we're going to ask questions and just have a conversation specifically about that element of their experience. These chairs are really fun. They swivel.
I can't stop moving.
Going to try to remember I'm wearing a short skirt. Okay. So we're going to dive right in because you don't want to hear me talk. You want to hear from the folks on this panel. So we've got 5 questions. We'll see how far we get. And not everyone may answer every question, but I think it will give you a good sense, of what folks have experienced and what we can do better, different, to support survivors as they are going through the healthcare system. All right. 50, need reading glasses now. So my first question is kind of a broad one. How do you think your experiences as a survivor of domestic violence or a domestic violence warrior have impacted your access to healthcare, or maybe your children's access to healthcare? So we're actually going to start at the end with one.
So, I'm going to start off by just not knowing how to address it, right? Addressing right off the bat that I'm a domestic violence warrior. And the reason I say warrior is because it takes a lot of courage to come up here. And for a man, at least from my point of view, like I said earlier, I didn't know how to show my emotions. So like speaking to any healthcare provider about what's going on in my life is kind of hard. So it's real difficult. And especially when children are involved. I don't want to say something that's going to end up them taking them away, some stuff like that, making it worse. So it's kind of, I don't know, it's just, how can I say, it's just, I have to be on my toes on stuff like that. So.
Yeah, and we shouldn't have to be on our toes, right? When we go to see a provider, it should be a place where we feel safe and that someone's going to help us.
Exactly.
Yeah. Thank you for sharing. Joanna?
Well, I can kind of agree with what you were talking about because I felt that uncomfortableness. It didn't feel like I was at a place where if I did have a major issue or concern that it would be taken care of. So when you mentioned the impacts, I started to think about self-care. So how can I take care of myself and not expect someone else to do that? Mm-hmm. And I had to correlate that and relate it to self-love. And so when I started to think about that, I just how can I make sure that I'm protected? And I often, when that question came up, I thought about when you're on an airplane and how the airline stewardess will give you all the emergency precautions and how she talks about if you're sitting next to an emergency window or door, how comfortable do you feel helping other people? And how everybody always gives those, I'm up for the challenge. And I often think, do they have some type of experience in helping in a situation like that? And then she goes on to say, if the air pressure drops, if you have a child next to you, or if you're sitting next to an older person, and the mask come down, what should you do first? Put your mask on first. And so that's just something I had to learn, that it's important to take care of myself first so I can be essential to anybody who comes in my presence that may be experiencing the same thing.
Yeah, I think that's such great advice, thinking about how we can center ourselves before we get into these experiences that might be a little bit stressful or scary. So thank you for that. Cecilia?
Pues buenas tardes, yo soy una sobreviviente de violencia doméstica y
Good afternoon. I am a survivor of domestic violence.
viví un trauma, para mí fue muy grande, más por mi niña, que yo sentí que ella no iba a vivir.
I lived a trauma that was very, very traumatic, and I felt that I was not going to be able to live to see my daughter grow up.
Porque mi esposo me sacó de casa.
My husband took me out of our house.
Me anduvo correteando porque me quería llevar.
He wanted to, he kept saying that he wanted to take me with him.
No sé qué pasó porque yo ando de corre y corre por todo el hospital.
I was running from him around the hospital.
Cuando desperté, pues ya iba en un carro amarrada.
And when I woke up, I was in a car tied up.
Llegamos a un área muy fea, solitaria.
We got to a really dark, lonely place that was really ugly.
Muy oscura.
Very dark.
Y allí me quería matar.
And that's where he wanted to kill me.
Hasta que llegó un policía.
Until a police officer arrived.
Y nomás, mire que nos sacó de ahí. Y agarramos frío. Y más adelantito, el carro en que íbamos se detuvo. Y ahí llegó la vuelta la policía. Yo nomás me acuerdo que me bajé y corrí a la patrulla.
When we were, just for content, I've been working with Ceci for the last 9 years, and so I know this story very well. I can fill this in a little bit for you. Her husband drove her up through from Los Angeles, from the medical center area where she works, up through the central coast of California, and his plan was to kill her there. And he knocked her out, and that's what she's explaining, is that when she woke up, everything was dark. And she thought that he was really going to kill her.
Y como no, pues yo no sé tanto inglés, el policía era bla bla puro inglés, me dijo que a dónde iba.
A police officer happened to pull over the car, and in English, she doesn't speak a lot of English, and in English she said, "Where are you going?"
Y él me dejó en una como parada de bus y yo no recuerdo, nomás anduve caminando y caminando porque andaba descalza, en pijama.
I don't have a lot of memory of the night, but I remember I just kept walking in circles. I was barefooted and I was in my pajamas.
Y nomás recuerdo que alguien me hablaba y yo anduve pidiendo dinero.
And I kept asking for money and for
Me
help,
acuerdo que tenía sed.
and I was thirsty.
Y no sé, alguien me habló, un señor de un dealer. Me dijo, le hablan por teléfono, porque yo el teléfono no lo... Pues no sabía ni leer las calles.
I was just wandering the streets, and then some man saying, "This person's calling you." I felt completely disoriented. I couldn't even read street signs. I didn't know where I was.
El señor que estaba por ahí lavando carros, me acuerdo que agarró el teléfono y él contestó. Me decía, ¿qué le pasa? ¿Qué le pasa?
And there's
Yo-
a man who was washing cars and kept asking me, "What's wrong with you? What's going on?"
Yo no podía hablar,
And I couldn't speak to him.
nomás oía muchas voces en el teléfono y me dijo el señor, le habla, es la policía.
Says the police is trying to contact you. It's the
Y
police.
su hija y la detective, pero pues yo no podía contestar nada, no podía hablar.
And he handed me the phone, and I couldn't answer any questions. But apparently, my daughter and my two daughters were looking for me, searching for me, and through the police officer that had pulled them over, that's how they tracked them down.
Nomás él me dijo que esperar ahí la policía, llegaron por mí, me llevaron a la estación y de ahí, desde Los Ángeles, fueron a...
They took me to that police station, and then they brought me back to the LAPD station.
No sé dónde era, más arriba de Bakersfield.
I know I was beyond Bakersfield.
Y ahí me recogieron y me trajeron a la oficina de la Primera y la San Luis. Y ahí me quedé con los detectives.
And they brought me back to the local police station, and I was just there with the detectives.
Me mandaron al doctor.
Then I went to the doctors.
Y ahí pues pasé una atención muy bien porque me atendieron muy bien.
And that's where the help that I received really, truly began.
Y me sentí segura.
I felt safe.
Rebeca estuvo a mi lado, ¿verdad, Rebeca?
Yes. I was there with her.
Me llevó a mi casa, me encerró que estuviera segura.
She took me home and made sure that I was safe. But this isn't about me. This is about you and Jenesse.
Pero es algo traumante, muy feo,
But it was so traumatizing and so horrible.
que todavía, yo siento que ya lo superé, pero todavía me queda algo.
And even though I feel for the most part I've been able to get past a lot of it, I know there's still something there.
Thank you so much for sharing your story. I think it's really important to acknowledge, the process, the pain, and I'm so grateful that you were able to get support through the doctor, Miss Rebecca here, helping you out, and that's part of why we do this conference and why we feel so strongly that every one of us has a unique and important role in preventing and responding to violence. And maybe not everyone is going to be able to get safety and security through the police. Maybe not everyone's going to call a domestic violence hotline. Dr. Raghavan talked about that this morning, right? But maybe you are going to the doctor for yourself or for your kids. And so if we have a healthcare system that knows what to do, that knows how to make a connection to a fantastic advocate like Rebecca, and so many of you in this room, we can make a real difference, right? We can have more people sitting up here as domestic violence warriors, telling their stories of how they were able to get that healing and help.
Virginia, if I can just add real quick, a important piece of this puzzle is that Cecilia actually is an employee of Los Angeles County Regional Medical Center. So she's a person on campus. And the reason why that's an important piece is because a lot of times us as professionals, we walk right past people that every day we feel are not going to be impacted. Right, and she's been working directly with our staff. At that point, it was 2 years. Now it's been 9 years. But had she not seen us on campus and had the strength to say this is what happened, and then I was like, wait a second. And then once we went to the emergency department, and everything just kind of kicked in, and I was like, this is one of your own. Yeah. This is your test right now. What are you going to do for her? And they were amazing. But that is an important piece to remember, even in our settings, right? We're not all, people are all around us. If we believe the statistics, it's a huge impact. So that's how we know each other.
I was wondering how I was going to be able to circle back to that piece of, really addressing things in our own settings. The healthcare space, it's great to train all the providers to talk to patients. And we have survivors who walk among us, who share the lunch table with us, right? And so making sure that when we think about those policies, when we think about the procedures, it includes staff at all levels. And of course, as Maya talked about earlier, if you have this experience in your present or in your past, it can make it a little bit harder, right? So it could feel like, oh, so-and-so is resistant to talking about these issues with patients or with clients. It's because they've also got their own stuff happening, and we want to address that too. We're not robot workers, right? AI has not completely taken over yet. I think we have 4 more years for that. So we want to make sure that we are first, making sure that our staff feel safe and secure before they're having conversations with others about violence and trauma. So thanks for the great segue. All right, glasses back on means I'm going to read a question. Okay, now this time we're going to start with Joanna, and I would like to ask, it's a 2-part question. What are the biggest fears that come up for you when you see a provider? And then, okay, we're going to get the scaries out and really give that advice of what can providers do to ease those fears.
On my journey as becoming a DV survivor, I was postpartum. I had a 4-month-old before I came to Jenesse. And when it was just, you go through that postpartum feelings of emotions. And I know for a fact when you go for those wellness checkups, they give you a list. And those questions concern, are you a DV? Are you a domestic violence survivor? And it goes through questions that are kind of daunting, if I had to be honest. And the questions go on saying things like, do you feel like harming yourself or others? And it's a long list. And you, of course, some of those things may be true, and you have to lie about it. And so I felt that it wasn't the comfort of being in an environment where I was supported. And I also had a fear that if I did answer anything that remotely is how I felt, that maybe someone would take my child, or maybe someone would bust through the room and put me in a straitjacket, to be honest. That's the position I was in. And so I thought about what can they possibly do to be able to ease that concern when they know that you are a domestic violent person. And so I thought maybe just giving them references or giving them contacts for shelters or food banks or hotlines that will be able to benefit them. And then that will take the ease off, so when they're in the comforts of maybe their own home, they can consider that, but they have the information to go home to and to use those resources if needed.
Yeah, I really like that. It's empowering, right, to get that information and be able to decide for yourself what you're going to do with it. Maybe you're going to put it away in a drawer and not look at it for a while. Maybe you're going to give it to a friend. Maybe you'll use it yourself. So thank you. That's great advice, not just for someone who's experiencing violence, but any patient, right? You also want to know what your information is being used for, because that's a real fear. I'm not really sure why you're asking me these questions, where it's going to be written down, where it's going to live, who you're going to share it with, what's going to happen. So maybe explaining. It's just like before a procedure, right? They tell you all the risks, benefits, what's happening next. Could be the same. We're going to keep going this way and then circle back.
¿Cuál es, qué es lo que-
Para mí es que cuando uno necesita el apoyo de ustedes, es que lo apoyen principalmente mentalmente.
For me, when somebody asks for help, a lot of the support that we need is mental health support.
Y hacerlo a uno que se sienta uno seguro de uno mismo para poder perder el miedo.
And reassure that you are providing a safe space and that you can reassure us that we're safe, so there isn't an environment of fear.
Y cuando uno cae en esa depresión, tenerle a uno paciencia porque es bien duro a veces poder contestar las preguntas que le hacen a uno, porque como uno está en un trauma, en vez de contestar siente uno temblor, miedo, ¿no?
And when we maybe are feeling a little bit depressed, to just be patient. A lot of times it's not easy to answer all the questions that you have for us, especially when you're processing all of the trauma.
Y otro miedo más grande de mi niña, porque estaba chiquita, y el miedo para mí era ella porque está sorda y no oía lo que estaba pasando.
My biggest fear was possibly losing my daughter and the effect that all of this had on her. She has hearing loss, and I wasn't sure how much she actually heard or understood of everything that had happened, and she was so young.
I want to just notice that all three of our panelists have talked about this fear of their children being taken away. That's such an important element here, right? In terms of seeking help and feeling like, we can share what's really happening in our lives. That's one of the biggest worries that survivors share with us, survivors with children. I cannot say anything because I'm worried that my kids are going to get taken away. So what can we do? How can we convey information and support so that isn't a risk, that isn't a barrier keeping people from seeking support? And I think what Joanna mentioned about instead of asking the questions and demanding that disclosure, you just share information with everyone, right? And if someone does feel like they're in a place where they can talk about what's happening at home, great. But if they can't, they still have access to the information. They know where to go for support. They have some concrete strategies to, be safer, to, get supports.
Barbara Kapos would say our services are not conditional, which is a very important point.
Yeah.
Shout out to my boss.
And I think, what can we do even in the community? Because there are probably many folks who are experiencing violence and they think, well, if I call someone like Rebecca, I have to call, it means I need a restraining order. I have had to talk, people assume that if I'm not in a place where I want to go into a shelter or get the police involved, these places aren't for me. So we need to do a better job letting people know, hey, we've got all kinds of services in your community. It doesn't require you to do anything. We are here for you. We believe you. It's not your fault. You're not alone. Help is available. That's really what our 40-hour domestic violence training boils down to, right? Those three things. Did you want to answer the question?
Sure. I don't know, for me, so I was brave enough to speak on the domestic violence on September the 14th. Once again, there was an incident, and police were called, and she put her hands on me in front of my kids, right? And I it was like I didn't know what to do. We picked up a CPS case, and she wasn't doing nothing for them. She has mental issues, and when I called the YWCA shelter, right, and I got there on January the 6th, and they took my kids on the 10th. And I entered the shelter, and I'm also a recovering alcoholic. So I had other issues. How they said it's not just one issue. It's a lot of issues. And when they took my kids, I wanted to leave. I knew where the nearest liquor store was at. And my Eskimo, it's one of my caseworker. She saved me. She sat me down, and she knew it because she's been there before. And she sat me down and she said, "Stop. You're not going to get nothing out of it. Right? It's going to the bottle again. What's that going to, what's that going to do? Nothing." And I think, a couple times I wanted to leave, and she told me, she's like, "You have the right to be here too, And not till I sat in this group with women that the only thing that I could say was the feeling, the feeling of just, to me, I was wired wrong, right? Growing up, I was wired wrong. I thought jealousy was, oh, she loves me, right? She loves me, she's jealous, right? And there was an incident when, I was talking to a female neighbor, and I came up the stairs, and she cut me with my own razor blade from work, right? And for a while, I couldn't have kitchen knives. I had to hide them. And that was a normal to me, right? That was a normal, and I didn't see nothing wrong with it. I didn't see nothing wrong with me having to get into a stool and get the kitchen knife to cut an apple for my son, right? And so when I sat in these groups, and the emotions that they went through, and I was like, yeah, I felt like that too, Why me? Why, what did I do wrong? Did I not love her enough? Was I the one? Was I not supposed to talk to anybody? Stuff like that. So I think when I knew what every part of the domestic violence, not just the physical and the economical and stuff that goes with it, right? And that's what made me realize, like, you know what? That wasn't the normal, Why should I live the way I'm feeling like that? So it's just, was a lot. Like, that shelter saved me. That's where I'm a warrior right here,
Yeah, definitely. Okay. All right, we're all taking a deep breath here on the stage. Okay. We're going to get into some marching orders, right? We've heard stories from survivors, and we want to know what we can do better. What are those concrete things that we can do, whether we're an advocate, whether we work in policy, whether we are providers, we're at a foundation, we work for the city, like, what can I change? Just like the morning plenary that Andrew did, what is our action plan? Given what we have heard today about people's experience in healthcare, how can we make a change? So I would love to hear from all of you. What is the one thing, if you had to pare it down to, okay, we'll give you 2 or 3. What are the main things that you would want a healthcare provider to know about supporting their patients who are also survivors and warriors?
I think for me, it's personally, it's just getting to the ground root of what's going on, not just what had happened, but like growing up, it takes a lot, like I said earlier, I didn't know how to process emotion, right? Because of my drinking. Growing up, I was never held. My mom never told me it's okay to cry and hold me, right? It was always, men don't cry and this, and and so one thing is, like, if you have an addiction or alcoholism, that's mental, right? It starts messing with your mental health, and to get down to the root of it, right? You need to ask questions, right? How did you grow up? Were you, so that's a lot of questions like that. So you could get to the root of the problem, because my problem wasn't the alcohol. It was me not knowing how to show my emotion, how to cry in front of somebody, especially another man. I didn't know how to do that. I would bottle up with what? The drugs and the liquor, So most of my, growing up, I had this mask, right? Somebody that wasn't even me, but that's how I grew up, having this mask all the time, wherever I went, and sometimes you have to, like going to prison and stuff like that, you can't. But really, this is me, right? This is who I'm sitting right here, is who I am, right? Emotional, like I said, how can I love you if I don't love myself, right? How can I show you compassion when I don't even know how to show compassion to myself, self-care, all that comes around with just loving yourself. So it's just, when it comes down to the root, that's where we got to find the problem.
Yeah. Well, we are glad that you're here, sitting on the stage with us, being your authentic self. We appreciate that. So a couple of things are just rising to the surface, of course, reminding us of Dr. Raghavan's talk this morning, right? And the opportunities that we have to talk with young people about managing their emotions, what a healthy relationship looks like. I mean, how our world could be different if everyone had those conversations with the young people in their lives, right? And then the second thing is really thinking about how our experiences in childhood impact how we relate as adults. So we're lucky enough to live in California, where we have, this is a whole other conference, but healthcare providers are encouraged and expected to talk with patients about experiences in childhood that may impact their health, both their physical and their mental health well-being. And so hopefully, here in California and a couple of other states, we're doing a little bit of a better job of that, right? Like not just thinking about the person sitting in front of you right now, but also how we all got here. So thank you for that. Do you want to go?
I just wanted to note that that DV, it's a dark and lonely place where your mind is distorted and your heart is confused about what you shouldn't do and what you should do, and you kind of feel like nobody understands your situation. You feel alone for the most part, and unfortunately, you almost feel like pain is a lifestyle because you get accustomed to it. And so that's something that I think that that's unfortunate, and you had to learn to adjust and learn to make those changes in your life where you learn from your situation and you grasp hold of what life really is. And so when something that may be beneficial to providers to offer to their, to anybody, I call it the Harriet Tubman soul. And many people have, I'm sure you heard about Harriet Tubman. She's freed many slaves and she came back, but I wanted to just read a quote that she has that I often think about when I'm talking to people, and maybe it'll help you. And it says, "I will come and get you. I know the way. I will keep coming back to this place I know. It may be dark, it may be uncomfortable, scary, and you may even want to go back, but I will not let you sacrifice us." Us is on the emphasis of making sure that I'm going to take care of you. And we're coming out. And then that just brings on a reassurance to a survivor that I'm supported, I'm cared for. They want to see me prosper and thrive. And when you feel like that, there's nothing that, it's a process, it's layered, but it gives you a sense of they're here for me. And you feel more comfortable in the environment, and you're open and receptive to what they offer you.
Yes, thank you so much. And I think it's so powerful for survivors to hear from other survivors, right? That kind of, as you mentioned also, being in a group, right? I started off my career many years ago facilitating groups as well. And it was always, I didn't have to do anything, right? It's connecting to each other. You have this sense that I was talking to a psychologist last week on a webinar for the VA, and he had like a very technical term for this feeling, this false feeling that you are the only person this is happening to. And when you think it's just you, it makes it much easier to blame yourself. You're like, well, this isn't happening to anyone else, so it must be something on me. But if providers can share, you know what, this is something that I see a lot, unfortunately. And there's also things that I can do to help. People I can connect you with, things that are related to your health that might be impacted. And so just building that community of knowing you're not alone. Yeah. But the Harriet Tubman quote also, I really like that because it reminds us how healing helping other people is as well, right? And so when we help others, it's good for the person we're helping, but it's also good for us. It helps build our power, our confidence, our, like we have a purpose in the world as well. So thank you for that.
Doña Ceci, ¿qué piensa que es lo más importante que nosotros debemos saber sobre las clases de servicio, de la manera que nosotros podemos ayudar a una sobreviviente?
Para mí es que en todo lo apoyo que nos han dado ustedes como proveedores, para mí han sido muy buenas las que están ahora, pero también pienso que necesitamos un poco como de, ¿cómo se dice? Como que haya cosas que lo puedan distraer a uno.
So I think that all of the services that I've received have been great, but maybe there could be an opportunity to create programs of distraction. And I think